I'm delighted to have everyone here for this panel discussion on health and wellness entrepreneurship opportunities in the complementary and alternative medicine industry. My name is Joyce Wukuda Konsei, and I'll be moderating this session. On the panel today are three esteemed individuals with significant experience in the complementary and alternative medicine industry. Number one, Mr. Mayfield Osetutu. Mr. Mayfield Osetutu is the Managing Director of Top Herbal Clinic. He is a clinical engineer and responsible for the formulation of all the herbal products at Top Herbal Clinic. He has over 13 years experience in his field of work. He researches in plant medicine and comes up with different products for the market. Number two, Nana Kwadwo Obiri. Nana Kwadwo Obiri is the General Secretary of the Ghana Federation of Traditional Medicine. He is also on the board of the Food and Drug Authority. He is an indigenous plant researcher and a chief herbalist. Nana is also licensed in Ghana by the Traditional Medicine Practice Council. Number three, Dr. Kofi Bobi Berema. Dr. Kofi Bobi Berema is the Executive Director at the Center for Plant Medicine Research. Dr. Berema has over 15 years experience in health promotion and community development and is currently on contract academic staff at Wilfrid Laurier University in Canada. Dr. Berema has over 15 years experience in health promotion and community development and is currently a contract academic staff at Wilfrid Laurier University in Canada. Dr. Berema holds a PhD in public health from the University of Aberdeen in the United Kingdom. He is the principal author of the book Traditional Medicine in Ghana. With such deep experience in complementary and alternative medicine on the panel, I look forward to very productive discussion. Let us begin. Mr. Mayfield, in your view, what was the impact on the demand for complementary and alternative medicines during the pandemic in Ghana?
To start with, the COVID, without a doubt, had a negative impact on all businesses, including the complementary and alternative medicine industry. But what really happened is that even though it had an impact on the industry, it enabled many people who normally did not have the interest of using herbal medication in one way or the other, had to use not herbal products, but use the plants, that people recommended. They might not have gone to the herbal industry or the alternative for medication, but it increased the interest that people had in herbal medications. So that is my preliminary response to that, the question.
Thank you very much. Mr. Obiri, would you agree with the statement that Mr. Osetutu just made?
Partially, I will agree with him. Yes, but I will take it in a different way.
Go ahead, please.
Yes, I feel COVID has come to really show the world what is truth and what is not true. When COVID came, for some time, we were not having the vaccine, we were not having the alternate and all these things. Traditional medicine practitioners, in their own way, as we have been practicing, helped Ghanaians, and COVID really showcased what we have in Ghana in terms of medications. So in my preliminary presentation, I would say that COVID has come at a bad time, but it has really exposed the truth and show the whole world that it is time we go back to our roots and we go and find what is ours and do it accordingly. Thank you.
So if I may ask a follow-up question from you, again, Mr. Obiri, in which particular medications do you think were employed or were used during during the pandemic? And what impact did you think they had on the disease or on infected people?
The first introduction of the steam bath, the first introduction of home remedies suggested by the Federation. Actually, this was led by myself, and we did announce that it has happened before, and what our forefathers did was this type, the steam bath, and then home remedies, which Ghanaians heeded to and resorted to. That actually started boosting the immune system of Ghanaians until the allopathic medicines also came in to help. So that is why I'm saying that until then, people were not recognizing this steam bath and then home remedies that we have been talking of and we have been developing. So COVID came, and now I can confidently tell you that Ghanaians are trooping to traditional medicine facilities, although traditional medicine has not been legalized for this COVID, but they are taking it to boost their immune system. So it is, for us in the industry, we know it is very good and timely it came.
Thank you. Mr. Kofi Bobby Berima, do you have a different view on the matter at all in terms of the role of alternative medicine and complementary medicine and during the pandemic that we're going through right now?
Yes, I don't have any different view, but I would just like to add that during this period, there were a lot of Ghanaians who preferred using herbal medicine. At the Center for Plant Medicine Research, we have a clinic, and proud to the COVID-19 pandemic, we were seeing 70 to 80 patients per day. And as a result of the pandemic, it increased to 100 to 140 per day. So this tells you that, I mean, there has been an increase. It's evidence for Ghanaians' preference for herbal medicine. That is all that I can say during that period.
Thank you. So a follow-up question on that is, what type of medications were being used for the steam baths and for the herbal remedies? Which ones stood up tall as those that were frequently being used?
Well, I think Nana Obiri mentioned those ones, so maybe he'll be in a position to elaborate on that.
Okay, Nana, do you have a sense of
Yes. Actually, what happened was that immediately it happens like that when we met a sector minister of health, and then some of our products were sent to the Center for Plant Medicine Research, and the preliminary report came, and 19 of the products, according to the preliminary report, show some activity in boosting the immune system of COVID patients. So Ghanaians relied on them, and then the other home remedies that we used were the neems, the nuclear latifolia, the phalanthus, and then the lemon and other home remedies. So that, I can say, actually helped Ghanaians. In addition to the medications that the practitioners were already using, like, I don't want to mention any name, that were actually endorsed, and as preliminarily, it can help boost the immune system of Ghanaians.
Thank you. So, Mr. Sechitu, in your view, what needs to be done to prove the efficacy of some of these complementary and alternative therapeutic approaches?
Okay, when it comes to proving the efficacy of the herbal medication, to me, in my view, we can go hand in hand with laboratory analysis, that is using animals as species for checking how potential those herbs are. But on the flip side too, we have these epidemiological studies. In these ones, it doesn't necessarily have to go through the lab processes, but studies can be made on medications that has already been approved by the FDA. You get patients having the problem, you give it to them, do your initial analysis on them, if it's for typhoid, ulcer, H. pylori, any medication, any health issue. The patient can take the medication, have all your lab analysis showing that the patient has it. And then at the end of the day, you do a lab test to confirm the absence or presence of these pathogens causing the diseases. We can also move into having animals to do the research, but that is quite expensive. If there can be a PPP with the universities, that can be taken up. That would also show how the herbal medications work. But if you also move into the dynamics of herbal medication, one, the orthodox would want the pathogens to be killed. But most of our herbal medications, it works by boosting the immune system. A plant like neem tree, for instance, has about 40 different chemicals in them. All these phytochemicals in them will have a different action on the body. So if we are to analyze it using these animals, yes, that would be fantastic. But if the cost will be too much, these epidemiological studies can be embarked on. And that one, it is very simple, and the results will be evident for all to see. So if we can embark on that direction, I think it's going to reap a lot of benefits for the nation, because these herbal products that have already been registered would have sort of a clinical backing to back the claims that we have on them.
Okay, wonderful. Thank you. We have I think that what you just said is quite important, because you're suggesting some kind of a clinical trial, but actually using the individual as a control. Am I right? So you're looking at the individuals.
Because people are already taking the medication already. It's been approved and people are already taking it. So why not just document its effects, and then further research can be done. Once it has been documented, it can be moved. It can be suggested from us that the orthodox medication, the allopathic practitioners can then have the confidence of also prescribing these medications because it has been documented.
Okay, so then essentially, as we're talking, this is more along the lines of authenticating the medication and putting through some clinical trial to actually validate its efficacy. So sure. I think we'll talk a little bit more down the road on that as well. I think it's interesting that you bring up the point that we looking at the individual as their own control, but also looking at alternative medicine as complementary to the already approved drug, and maybe and together having them work sequentially to improve outcomes for the patient. I think somebody was trying to speak.
Yes, here I'd just like to add something that as a follow-up to what was just said. Currently, we are conducting clinical trials with KNUST using one of our products, Libima, that has been registered with the FDA for malaria. So we are using that one for clinical trials, and we will come out with the results when it's ready. As at now, we are not talking about what is going on. We don't want to come out with preliminary results when we have not concluded. So this is what we have decided with our partners. So I just want you to know that we are conducting clinical trials with people who have 19. It's going on now.
Wonderful.
So just for your information.
Right, so that takes us. Oh, sorry. So please go ahead. So that was Mr. Obri, am I right?
Thank you.
Thank you.
This
Thank you very much.
Dr. Kofi Bobi Barima.
Dr. Kofi Bobi, thank you very much. So I think you're hinting on clinical trials and you're talking about the fact that there's some ongoing trials, obviously, which you cannot talk about, but the results, we'll be waiting for the results and hoping that they add value to the therapy. So let's move on. I think it's a nice segue to talk about this other idea that we're supposed to explore.
Maybe, Madam.
Yes,
maybe
please.
Let me contribute over here.
I'm sorry, who? Okay.
Nana Obri.
Nana Obri, go ahead, please.
Moderator, please. When we talk about COVID-19 or the issue of traditional medicine being developed, like Center for Plant Medicine has rightly said, that there is an ongoing clinical trial on this. I, on behalf of traditional medicine practitioners who want to call for total collaboration, and this collaboration, in fact, when I send this notice of us being on this program to traditional medicine practitioners across the country, it has become surprise to them that this is the first time the Minister of Finance or a ministerial institution alongside with the office of the president is organizing something, and they are involving traditional medicine practitioners, the indigenous traditional medicine practitioners. And let me say that, first of all, we need to congratulate the SGD 2021 program organizers, because it is the first of its kind. We have never and have not ever had any program like that. And they will ask and know that there are indigenous traditional medicine practitioners who are also doing something in this country. So I am calling for total collaboration between the office of the president, the traditional medicine practitioners, Ministry of Health, and relevant stakeholders, so that there will be a level playground for everybody. I will continue about that.
Thank you. So my next question is going to, under the main driving forces responsible for the transforming the trajectory of the current industry. So the main driving force responsible for transforming the trajectory of the industry. A question I have is, what validated clinical trial processes are available for proving efficacy of complementary and alternative medicines? Okay, so
everybody, there should be collaboration, as Nano said, involving practitioners, involving researchers, and then involving policymakers. Now, the government of Ghana has made integration of herbal medicine as a policy since 2012. And you also see that a department of complementary and alternative medicine has been established at the Ministry of Health. We also have the Traditional Medicine Practice Council that is in place to regulate the practice. And then one also interesting aspect of it too is that the government has realized that in terms of universal health coverage, herbal medicine should be affordable and accessible to Ghanaians. And now the Ministry of Health is trying to implement the inclusion of essential herbal medicine list into the National Health Insurance, which is a step in the right direction. We also have the Ghana Federation of Traditional Medicine Practitioners Association that have also been making their concerns known, as Nana Obri is trying to do now. And then we have support from the Ministry of Health, which is very, very crucial because they make the policy. And one good thing too, the driving force about transforming is that Ghanaians have preference for herbal medicine. As you are aware, since time immemorial, a lot of Ghanaians have been using herbal medicine. And even now, studies have shown that 70% of Ghanaians rely on herbal medicine for various needs. And as I said in my opening remarks, you can also see that when the pandemic came, Ghanaians also looked for alternative or complementary medicine. And this may account for why there has been increase in the services of the products that we have in our center. And these days, the Ministry of Health is looking at in research and also in the looking at the whole supply chain of the herbal medicine industry. And this is what we have been doing to assist. Thank you very much.
Thank you. So I guess my question still stands, which is so there's work being done, but what I wanted to know is currently what validated clinical trial processes are available for proving efficacy of complementary and alternative medicine. Are there any? Are there any?
Well, as Nana Obi said, there's a committee. In actual fact, there's a committee in place that is coming out with those procedures. We have worked on it, and the report will come out in terms of what needs to be done. So yes, something is going on, and the document will come out very soon. So that was why Nana Obi was saying that he's surprised that maybe there's nothing there and something is going on. That is the import of what Nana was trying to say.
Thank you. So I'm happy to hear there's something in process. So Mr. Osei-Tutu, do you think once these processes are in place, they would have a positive impact on the current growth trajectory of alternative and complementary medicine in Ghana?
I would say yes. Once they are properly established, it's going to help. But my problem that I have is, it seems there is a will for the industry to move, but the will is being stagnated. Why am I saying that the will is being stagnated? Anytime you raise practicable steps that the industry can embark on, it's kind of too stringent. Yes, so it's too stringent. So people are not able to go through the entire process and the entire, what do you call it, the process to enable us have good medication, because these herbal medications are something that mostly were passed on. So people should be able to come forward with their herbal formulas, and then the state can investigate into it. At the same time, not holding onto the property of the individuals. So I would say, because there's nothing like a patent system in the country, herbalists don't have the free will to give out the medications that they have, because if it's a neem tree, it's a neem tree. And once you say it's a neem tree, other people can also pick on it. Meanwhile, it's your intellectual property. There's nothing like that to protect the herbal, what do you call it, industry, let me say, in that front. What I also want to add is that for the industry to move on, people should see the profitability of it. In that case, you'll be able to get individuals with or individuals or investors having the funds to also help. Let me use a typical example. I don't want to sound controversial, but let me use the men's gold saga as an issue. Once people put their money in it, and it seems, I'm using the word seems in quotes, it seems that they were making some headway, people rushed into it. So with that same idea, if government can pick, which I know will be somehow controversial as to the modalities that would be employed, but if government can have a PPP with willing herbal industries, and then move to the point where the herbal medications would go through a clinical trial, have it showcased, make it public. It increases the confidence of people in it. And then once a PPP, it will be able to move across the country and even outside. Once it goes outside and then people see that, oh, okay, the medications are good. And aside that too, it is profitable. Then you can have investors investing their monies in it, because the herbal industry has a huge potential. That potential has to be showcased. Another example is on the same front, herbal medications from Ghana, for instance, is accepted across the African continent. They have the trust that Ghanaians are not 419, Ghanaians are truthful, Ghanaians are honest. So if they say this medication does this, it works. So we have that leverage in all the African countries. What we need is good legal backing from the government of Ghana and take advantages of the present situation and then be able to move the industry forward. So this is what I have to say on that.
Thank you. So I'm going to go to Dr. Kofi Bobby Berima. Doc, Berima. Oh my gosh, Doc. Sorry. So Doc, question. Given what we just discussed, what Mr. Osei-Tutu just talked about, what role do you think government can play to help the alternative and comparative medicine industry to elevate its growth from the current trajectory to a higher level?
Yes,
is there a role for government in your view? And if so, what is it?
Role for government, and I think that I mentioned some of them already. And based on what Nana Obri has just said and what Mr. Osei-Tutu has said, I think that in the industry, there is this sense of sometimes mistrust and then secrecy, as he said, in terms of intellectual properties. So I think that the whole idea of intellectual property should be looked at. As a matter of fact, at the Center for Plant Medicine Research, we have now set up an intellectual property committee to ensure that the right thing is done in terms of patents and some other things. Sometimes traditional healers or herbalists may have very good medication, but when they are sharing the ideas, it becomes a problem about how they can claim ownership. So I'm very sure that the government can work in this area. We also have the Traditional Medicine Practice Council. And as I said, I serve on it, and there are various ideas that are being put forward to ensure that this issue is looked at in this way. And also the Food and Drug Authority too can also play a role in making sure that we all work together as a team to make sure that people will feel comfortable about the type of products or knowledge that are shared. Yeah.
Thank you. So Nana Obri, a question for you. So given all the discussions we've had, and I believe we've mentioned about the belief or the trust folks in the sub-region have about Ghanaian alternative medicine, in your view, are there particular niche segments where Ghana can have a comparative or competitive advantage in the sub-region in alternative and complementary medicine?
Thank you. I want to say that national innovation policies, which focus on scientific and technological research and development, the future advancement of viability of Ghana's traditional medicine sector, hinges in creating an operational environment that takes advantage of the informal nature of traditional medicine practice while continuing to encourage innovations and strengthen entrepreneurship for improved quality and efficacy of complementary and alternative medicinal products and practices. Traditional medicine practitioners have also been working to enhance the practice. Traditional medicine thrives on locally available resources and knowledge of the healthcare value of plants and their derivatives. Practitioners play a key role sharing knowledge and in adding value to and improving the quality of delivery of their products and practices. In particular, through the formation of a strong network of traditional medicine practitioners associations, which is under the umbrella of the Ghana Federation of Traditional Medicine Practitioners Associations, recognized by Act 575/2000. I am looking at some few challenges which I think we just have to see. The inability.
I'm asking that, do you see that we have a niche? So does Ghana have any advantage? You know, because the question, the broad question is for us to look at the growth potential and niche segments for Ghana in the sub-region. So I'm asking, which segments do you think Ghana would have a niche? Yes, and why?
The niche segment which I think Ghana have is for us to go into the raw plant cultivation, and that's looking at our vegetation at the sub-region. We have very good herbarium that we can plant this product. For instance, a product like Cropton and then Cryptolepis sanguinolenta, it is very, very expensive. A bag of Cropton is 3 times what of cocoa, and a bag of Cryptolepis sanguinolenta cost about 5 times what of cocoa. So we are saying that when Ghana or the government motivates traditional medicine practitioners as well as cultivators of traditional medicinal plants, it will get more money than the cocoa coffee that we are exporting. So I think Ghana should take opportunity at this sector, and then we can grow.
Thank you very much. So Mr. Osei-Tutu, a question for you. And I think you actually mentioned the fact that Ghanaian alternative medicine seems to be well respected in the region. So a question for you, do you think Ghana is well positioned to become a hub for complementary and alternative medicine in the region? And if so, why?
I say a capital yes to that question. I've been around the African continent. In Togo, in Togo, for instance, they don't have any law backing their herbal industry. In Burkina, it's the same. And I think it's the same. I think it's only in Ghana and Nigeria that we have some laws for the herbal industry. So at the moment, most of these African countries are looking forward to what Ghana does. So the earlier we take advantage of that, the better. One, as I said earlier on, they trust in every herbal medicines that has made in Ghana on it. So if there's a made in Ghana herbal medication and a made in any other African country, I bet you the made in Ghana products will be the first to move. Based on this that I've seen across the African continents, if energies can be directed towards that side, I think there will be tremendous improvements in the industry.
Okay, thank you very much. For your comments. Now, I need everybody to comment on this one, and so I'm going to ask, get it right, Joyce. Now, Dr. Kofi Bobby Berima.
Yes.
Any input? So maybe I can ask you a direct question actually to this. In your view, what is the stock of scientific knowledge and expertise for complementary and alternative medicine in Ghana? And how can this be leveraged to elevate the current growth trajectory that the sector is on to higher grounds?
Yeah, thank you. I think I will start with the initial comment where the other speaker left. To just the establishment of the Traditional Medicine Practice Council is something that is in a different niche altogether within the sub-region. The others do not have it. And also the fact that some of the policies that the government has started implementing on a very strategic way, in terms of the fact that now the government has a policy of integration, and in about 50 hospitals in Ghana, when you go, we have access to herbal medicine, and that is very significant. That means the government is moving forward to do all these things. And the government too, or the studies have also been done that as far as the 2020 Global Complementary and Alternative Medicine Report indicated that the value of the industry is about 82 billion US dollars. And this will keep on expanding based on the type of investments that the government will make in this area. And there are indications that the government is going to make a massive investment in the development of the complementary and herbal medicine industry, especially when it comes to the Center for Plant Medicine Research. So these are things that are very, very crucial. And we also know that Ghanaians still continue to make herbal medicine something of a choice. So we all saw how a lot of people have been using it. So with this one in mind, and the type of research that the government has done, for instance, if you look at the essential herbal medicine list, the government has done a lot of research that is through the Ministry of Health, and some, it's not all of them, have been approved for now. I don't know whether I'm in a position to talk about the numbers that have been improved and then the type of industries that are doing. But I can tell you that research has been done in this area, and we expect the results to be released from the appropriate quarters because we work with protocols. But I can assure you that background work has been done.
Okay, thank you. Thank you, everybody. I think so. You've talked very positively about your industry and the potential it holds. You talked about the role that COVID-19, although a bad incident, has uncovered the need for alternative and complementary medicine. You've also talked about the role government can play to help elevate us and what private sector can do to elevate the industry from the current growth trajectory to higher levels. I think my parting questions are, this all sounds extremely good. So there must be some entrepreneurs out there saying, how do I get a piece of the action? How do I get involved in this industry? So I'm going to give every one of you maybe about 2 minutes to summarize your advice to a budding entrepreneur who's excited by what you've talked about here with regards to the alternative and complementary medicine, who wants to get involved. What is your advice to that individual? So perhaps we can start with you, Dr. Kofi Bobi Barima. If you can, since you're on the deck, if you can just give us your advice to the budding entrepreneur, and we'll go to Dan Obri and then on to Mr. Osetutu. Thank you.
I will advise people to get into the cultivation of plants that have medicinal value. We have mahogany, croton, neem tree, and some others. And then also production of herbal medicines to meet the increased demand of medicine. As I said, there are over 50 health facilities that you can have access to herbal medicine. And this means that we have to increase production. And also marketing and distributing of herbal products. The whole value chain will have to be improved to make sure that this thing goes on. Also setting up of herbal medicine clinics to create jobs, because we have a lot of herbal medical herbalists who are coming up, so we can set up herbal medicine clinics to address this issue. Also, individuals also set up their own practice and do this area. So I think that these are some other areas. Especially we have youth unemployment. So we can have youth in herbal medicine develop where they can concentrate on cultivation of herbal and all these ones. Thank you very much.
Thank you, Doctor. So Nana Obri, can you give us some parting thoughts for the budding entrepreneur who wants to get into this very exciting industry of yours? I think you're on mute, Mr. Nanobri. Nanobri, I think you're, yes, thank you.
The industry is very exciting. And because of that, a lot of people want to take and do advantage over the industry. So first of all, I would want to ask that, and this will first go to the general public. People must look out for registered traditional medicine practitioners across the country. We have registered one who has been trained and has been going about. Not every traditional medicine practitioner is a traditional medicine practitioner by law or legalized to work with herbs or traditional medicine. Then the next one will also go to advise that we think there should be the Minister of Finance in collaboration with the Ministry of Health should also set up a fund for traditional medicine development under the office of the Ghana Federation of Traditional Medicine Practitioners, so that this fund, the indigenous traditional medicine practitioners, will take advantage of it to research into their products and go into more and broad the industry. I will also want to say that once we are all going about these things, and we will need a liaison officer for traditional medicine who have interest in the traditional medicine, not somebody who has been appointed, somebody who have interest. We know all of them, so that they will be advising the office of the president in terms of traditional medicine services, so that traditional Ghanaian medicine would actually strive. We also want to advise that as Ghana Federation of Traditional Medicine Practitioners was set up by the government to take charge and be the mouthpiece of traditional medicine practices. Government should at least try to help this institution, since we are doing in-service training for our people and all these things. There are no funds. So we think government should help and then facilitate all this training for traditional medicine practitioners. 40,600 traditional medicine practitioners. Thank you very much.
Thank you very much, Nanobri. Now, can we have the last word from the panel from Mr. Osei-Tutu? Your comments and final comments and advice to anyone who is interested in getting into a very dynamic and exciting industry. Thank you.
Okay, with the herbal industry, for the growth to be enhanced and for the line to be steep, well, there has to be modernization. So entrepreneurs can take advantage of that. If I say modernization, I mean entrepreneurs can invest in building facilities for herbal industries. Entrepreneurs can invest in machinery and digitalization of our processes. And then entrepreneurs can also move into the marketing field of the herbal products. This would help move the product to the final consumers. And then the entrepreneurs would also not make losses. So these are a few areas where entrepreneurs listening to this discussion can focus on. Aside this, as Nana Obri has said, government is the number one spender in every economy. Once the government sees the potential in the industry, time and tide waits for no man. So if government, I said it before, if government can move into a PPP with the federation and set up a model industry, like what they've done with the pineapple juice industry, it's a fantastic idea. If that can be done, that process would break, would cross every hurdle in terms of the bottlenecks. Then people can see the full potential. Once medications, once herbal products are exported in huge amounts from the country to other African countries, and it's been supported by the government, other investments would also move in because they would see the potential of the industry. So that will be my final comment.
It's been an exhilarating discussion, everybody, on this panel, deliberating on entrepreneurship opportunities in alternative and complementary medicine. Thanks a lot for your insights. I'm sure our listeners learned a heck of a lot from you. We look forward to more at the next session next year. Take care and God bless.
Hey,